Cipro, the brand name for the antibiotic ciprofloxacin, is a widely prescribed medication belonging to the fluoroquinolone class of antibiotics. Developed and marketed by Bayer, this potent drug has been a mainstay in the treatment of various bacterial infections for several decades. In this comprehensive guide, we will delve into the intricacies of Cipro, exploring its common uses, advantages, potential adverse effects, dosage recommendations, precautions, and alternatives. Ciprofloxacin, the active ingredient in Cipro, works by inhibiting the activity of specific enzymes essential for bacterial DNA replication and repair. This disruption ultimately leads to the death of the targeted bacteria, making Cipro an effective weapon against a wide range of bacterial infections. However, it's crucial to understand that Cipro is not effective against viral infections, such as the common cold or influenza. As we navigate through this video, we will unravel the complexities surrounding Cipro, empowering you with the knowledge to make informed decisions about its usage and potential risks. Common uses of Cipro. Cipro is a versatile antibiotic prescribed for various bacterial infections, including respiratory tract infections, bronchitis, pneumonia, sinus infections, urinary tract infections, UTIs, kidney infections, bladder infections, skin and soft tissue infections, cellulitis, abscesses, bone and joint infections, osteomyelitis, septic arthritis, gastrointestinal infections, traveler's diarrhea caused by certain bacteria, intra-abdominal infections, peritonitis, abscesses, certain types of sexually transmitted diseases, STDs, gonorrhea. It's important to note that Cipro should only be used for bacterial infections and not for viral illnesses, as it will be ineffective against viruses. Advantages of using Cipro. Cipro offers several advantages that contribute to its widespread use. Broad-spectrum activity. Cipro is effective against a wide range of gram-positive and gram-negative bacteria, making it a versatile choice for treating various bacterial infections. Oral administration. Unlike some antibiotics that require intravenous administration, Cipro can be taken orally, which is more convenient for patients and allows for outpatient treatment in many cases. Tissue penetration. Cipro has excellent tissue penetration, allowing it to reach and effectively treat infections in various body sites, including the respiratory tract, urinary tract, and soft tissues. Concentration in urine. Cipro achieves high concentrations in the urine, making it particularly effective for treating urinary tract infections. Once daily dosing. For certain infections, Cipro can be administered once daily, improving patient compliance and convenience. Potential adverse effects of Cipro. While Cipro is generally well tolerated, it can cause a range of adverse effects, some of which may be severe. These potential side effects include gastrointestinal disturbances, nausea, vomiting, diarrhea, and abdominal pain are common side effects associated with Cipro use. Central nervous system effects, headaches, dizziness, confusion, and insomnia have been reported in some patients taking Cipro. Tendon disorders. Cipro and other fluoroquinolone antibiotics have been linked to an increased risk of tendon rupture, particularly in the Achilles tendon. This risk is heightened in older adults and those taking corticosteroids. Peripheral neuropathy. Cipro has been associated with the development of peripheral neuropathy, characterized by tingling, numbness, and weakness in the extremities. Photosensitivity. Cipro can cause increased sensitivity to sunlight, leading to sunburn or rash in some patients. Cardiac effects. Rare but serious side effects, such as prolonged quart interval and irregular heart rhythms, have been reported with Cipro use. Allergic reactions. Some patients may experience allergic reactions, ranging from mild rashes to severe, life-threatening anaphylaxis. It's essential to discuss any potential side effects with your healthcare provider and report any concerning symptoms promptly. Dosage recommendations for Cipro. The dosage of Cipro depends on various factors, including the type and severity of the infection, the patient's age, weight, and renal function. Here are some general dosage guidelines for Cipro. Oral dosage for adults. Urinary tract infections, 250,500 mg twice daily for 3-14 days. Respiratory tract infections, 500,750 mg twice daily for 7-14 days. Gastrointestinal infections, 500 mg twice daily for 5-7 days. Intravenous, IV, dosage for adults. Severe or complicated infections, 400 mg every 12 hours. Pediatric dosage. Oral dosage, 10-20 mg per kilogram twice daily, depending on the type of infection. IV dosage, 10 mg per kilogram every 12 hours. It's crucial to follow the prescribed dosage and duration of treatment to ensure the best possible outcome and minimize the risk of adverse effects or antibiotic resistance. Precautions and dangers associated with Cipro. While Cipro is an effective antibiotic, it is essential to be aware of certain precautions and potential dangers associated with its use. Tendon rupture risk. Cipro and other fluoroquinolone antibiotics have been linked to an increased risk of tendon rupture, particularly in the Achilles tendon. This risk is heightened in older adults, those with kidney, heart, or lung transplants, and those taking corticosteroids. Peripheral neuropathy. Cipro has been associated with the development of peripheral neuropathy, characterized by tingling, numbness, and weakness in the extremities. This risk may be higher in patients with certain risk factors, such as diabetes or renal impairment. Prolonged quart interval. Cipro can prolong the quart interval on an electrocardiogram, ECG, increasing the risk of developing abnormal heart rhythms, arrhythmias. This risk is higher in patients with underlying heart conditions or those taking certain medications that can also prolong the quart interval. Antibiotic resistance. Overuse or misuse of Cipro and other antibiotics can contribute to the development of antibiotic-resistant bacteria, making infections harder to treat. Interactions with other medications. Cipro can interact with various medications, including certain antacids, anti-seizure medications, and drugs that prolong the quart interval. It's essential to inform your healthcare provider about all medications you are taking to avoid potential interactions. Used during pregnancy and breastfeeding. Cipro should be used with caution during pregnancy and breastfeeding, as it may pose risks to the developing fetus or nursing infant. It's crucial to discuss these precautions and potential dangers with your healthcare provider before starting Cipro treatment and to report any concerning symptoms promptly. Alternatives to Cipro. In some cases, alternative antibiotics may be preferred over Cipro, depending on the type of infection, patient-specific factors, and the potential risks and benefits of each option. Some alternative antibiotics include other fluoroquinolones, levofloxacin, Levaquin, and moxifloxacin, Avelox, are alternative fluoroquinolone antibiotics that may be used in certain situations. Cephalosporins. Antibiotics like cefuroxime, ceftriaxone, and kevaherme may be suitable alternatives for certain respiratory or urinary tract infections. Penicillins. Amoxicillin, amoxicillin clavulanate, and piperacillin tazobactam are penicillin-based antibiotics that can be considered for some infections. Macrolides. Azithromycin and clarithromycin are macrolide antibiotics that may be used for respiratory tract infections or certain skin and soft tissue infections. Trimethoprim sulfamethoxazole. This combination antibiotic can be an alternative for urinary tract infections or certain respiratory infections. The choice of an alternative antibiotic depends on various factors, including the specific infection, the patient's medical history, potential drug interactions, and local antibiotic resistance patterns. Your healthcare provider will carefully evaluate these factors to determine the most appropriate treatment option. Frequently asked questions about Cipro. Can Cipro be taken with other medications? Cipro can interact with various medications, including antacids, anti-seizure medications, and drugs that prolong the quart interval. It's essential to inform your healthcare provider about all medications you are taking to avoid potential interactions. How long does it take for Cipro to work? The time it takes for Cipro to work can vary depending on the type and severity of the infection. Generally, patients may start to feel better within a few days of starting treatment, but it's crucial to complete the entire course of antibiotics as prescribed to ensure complete resolution of the infection. Can Cipro cause sun sensitivity? Yes, Cipro can cause increased sensitivity to sunlight, leading to sunburn or rash in some patients. It's recommended to limit sun exposure and use protective measures, such as wearing protective clothing and applying sunscreen, while taking Cipro. Is Cipro safe for children? Cipro is generally considered safe for use in children, but the dosage needs to be adjusted based on the child's weight and age. However, it is typically not recommended for children under 18 years of age due to the potential risk of adverse effects on developing cartilage and joints. Can Cipro be taken during pregnancy or breastfeeding? Cipro should be used with caution during pregnancy and breastfeeding, as it may pose risks to the developing fetus or nursing infant. Your healthcare provider will carefully evaluate the potential benefits and risks before prescribing Cipro during these times. Conclusion: is Cipro the right choice for you? Cipro is a powerful and versatile antibiotic that has proven its effectiveness in treating various bacterial infections. However, like any medication, it comes with potential risks and adverse effects that should be carefully considered. The decision to use Cipro ultimately depends on factors such as the type and severity of the infection, the patient's medical history, and the potential risks and benefits of the treatment. It's essential to have an open and honest discussion with your healthcare provider, weighing the pros and cons of Cipro and exploring alternative treatment options if available. By staying informed and following your healthcare provider's guidance, you can make an informed decision about whether Cipro is the right choice for your specific situation. If you or a loved one are considering Cipro as a treatment option, it's crucial to consult with a qualified healthcare professional. At our clinic, we have a team of experienced physicians who can evaluate your unique circumstances and provide personalized guidance on the appropriate use of Cipro or alternative treatments. Don't hesitate to schedule an appointment today and take the first step towards a well-informed decision for your health.